Hello, and welcome to the Minnesota Department of Health webinar, Writing Meaningful Goals and SMART Objectives. The Minnesota Department of Health, or MDH, originally held this webinar in 2016, and today's updated version contains much of the same information. Knowing how to write goals and objectives is evergreen work. That is, it's something that will always be helpful for putting your organization's mission into practice. Today, we'll start with some definitions and common language for the words we're going to use, so that we make sure that we're all on the same page as we move forward. We'll also talk about why meaningful goals and SMART objectives can help us do our work better. After that, we'll dig into what meaningful goals look like in practice, what they are and why they matter, how to write them, and connecting them to objectives. Finally, we'll look at what it means for an objective to be SMART, why SMART is important, and we'll learn how to write SMART objectives together. So first, let's get on the same page. When we're thinking about planning and where we want a program or organization to be moving forward, we use a lot of similar words to describe the same concepts. Words like outcome, benchmark, measure, target, and more. Then we use even more words to subdivide those first words, and we end up with phrases like measurable outcome and priority benchmark and core measure, and they all start to sound the same. What makes one set of terms different from another? Do they all mean the same thing in the end? Interchangeable words like this can be confusing, internally and externally. Our staff and our partners might wonder if we mean two different things when we say outcome and benchmark, and then they're stuck trying to figure out what our words mean, instead of engaging in big picture thinking with us. Once we settle on words, it's important for us to be consistent when we're talking about these concepts. Whatever words you choose, use them in the same way and for the same purpose. So let's agree on some common words and phrases for this training, and I encourage you to also simplify the way you talk about goals and objectives when you are planning. For this presentation, we're going to use the word goal to describe what we aspire to be or do, or what we want to achieve. Next, objectives describe how we're going to meet that goal and how we'll measure our progress. Think of the goal like an umbrella, with different objectives sitting underneath it. The objectives help you achieve that goal. You can use this goals and objectives framework to break down action in any plan: a QI plan, a strategic plan, a community health improvement plan, and more. For example, a goal could be something like, adolescents in Tubman County don't use tobacco. This is an aspirational statement that describes a future state we want to see. One objective, which will help measure progress toward that goal, could be, by the end of the year, increase the percent of establishments that pass tobacco checks from 75% to 80%. This objective helps make our goal more concrete. It helps us set out one specific way to make this goal a reality and measure progress toward that goal along the way. Remember, most goals have more than one objective or many objectives. This is just one example. Consider this second objective that works to meet this goal on another front. By 2025, increase the percent of Tubman County students who haven't smoked in the past 30 days. Both objectives are helpful as they work to engage different groups to make progress toward your goal. You'd likely have many other objectives under this single goal for many different groups and activities. Breaking work down into goals and objectives helps big ideas become more concrete. Goals and objectives provide direction and structure across big topics. Objectives especially can help you monitor your progress and measure where you're moving toward a goal with success, or identify opportunities for improvement, where you're falling short and need to rethink your strategy. You can also use goals and objectives to help communicate your impact, what's changed, and where you're making progress. Now, let's dig deeper into meaningful goals. Remember, goals are broad, future-oriented statements that describe where you want to be, what you expect the effect will be from your actions. Goals define what's in scope and what's out of scope as you move forward. That is, what's in bounds and what's out. You can't do everything for everyone, so be specific and stick to it. Finally, as we noted before, goals provide a framework or umbrella under which your objectives sit, grouping them in a logical way. Let's think about what a checklist for meaningful goals might include. When you're writing a goal, make sure it's concise. Less is more. Don't get bogged down in trying to illustrate or explain everything you're trying to do. Just stay focused. Make sure your goal is free from jargon. Remember, when you use a jargony word that your audience doesn't understand, they stop listening to you while they try to figure out what your jargon meant, and then they have to work to catch up with the rest of what you're saying. Avoid acronyms, words, and phrases that people outside your team won't understand. Be specific about what you expect to happen. Specific means you can more easily measure progress. Make sure your audience can easily understand your goal, that your partners are familiar with the concepts you're discussing. Use declarative statements. That is, declare what will happen. Don't frame it as a question to answer or an idea you're trying to flesh out or a problem you're trying to solve. Save that information for other parts of your plan. Instead, state clearly and definitively what you expect or hope will happen. Lastly, the goal shouldn't include language about a specific solution or a specific service or program. That is, don't put the cart before the horse or have your goal be a solution in search of a problem. The goal isn't there to make sure your work plan is justified or to talk about how you're going to get somewhere. Remember, the goal is your ultimate destination. Let's think about what this might look like in practice. Let's start with this goal. We want a healthy workplace. But what does that mean? To rewrite it, let's consider, what future state do we envision? What's our expected effect? What does health look like in the workplace? What's our scope? What's in bounds and what's out of bounds? Whose health do we mean? And what kind of health? How would our objectives fit into this framework? It feels like a lot of work could fit under this umbrella, and tracking all of that could get overwhelming. Let's try this goal instead. All employees in Tubman County will work in environments that support mental well-being. What's our expected effect? Environments that support mental well-being. We can define what makes up those sorts of environments later in our plan, but this is enough for our goal statement. What about our scope? Well, it's all employees. This doesn't involve people from outside our organization for now, at least not for this goal. There could easily be other goals in the plan that target different groups. It's also just about mental health and mental well-being. If we want to address other kinds of health, we can do that in another part of our plan. How might we start thinking about possible objectives? Well, we've got some key words. All employees, work environments, and mental well-being. Those words give us some ways to start envisioning specific actions we'll take to reach this goal, and we'll lay those out later in our objectives. Let's try another goal for a different topic. In this one, we'd like to decrease the number of colleges, government buildings, public housing buildings, rental units, fairs, and community events that have not formally adopted a tobacco-free grounds policy based on the best practice legal language recommended by the Public Health Law Center. That's a mouthful. Remember, we want to be concise when we're writing goals. Less is more. The place to start getting specific about how and where we're making those goals a reality doesn't need to be in the goal itself. Maybe we could put that later on in the objectives. we've also got some double negatives happening. We're decreasing places that haven't done something. That could easily trip up our readers. For now, it's enough to say, we want to make sure everyone in Tubman County can live, work, and play without exposure to secondhand smoke. It's concise, it shares the future state we hope to see, and still gets us to the same place. Let's look at one more goal together. Here, we want to continue to work on child care initiatives to ensure all children have access to high-quality child care so they're ready for school. Do you notice something? We've included the solution in the goal itself. We're saying we're going to do it through child care initiatives and with high-quality child care. Those are really good things to pursue, but they don't belong in our goal, which should focus on the ultimate destination, not how we're getting there. Instead, let's say all Tubman County children are ready for school. Later on in our plan, we can address things that will get us there, like high-quality childcare. But for now, we're focusing on the future outcome and who's affected. Before we leave this section on meaningful goals, let's take some time to consider how to build equity into our goals. Centering health equity in our work is critical to building community health and well-being. Let's think about how we usually draft goals. How do we determine what's expected of our organization? There are a lot of things that drive our organization's goals, like codes and statutes, funders, accreditation, other plans. However, when we're setting goals, starting with our own organization's needs might not be the right place to start, even though it's often the easiest or the most intuitive. We can't completely disregard the forces listed here, but they don't need to be the only thing that drives us in setting goals. Part of our role in public health is to ensure that we're meeting our community's needs, and that means all of our communities. When thinking about goals, let's go a step further. Who's in the room when you're writing these goals? Whose goals are they? What do our goals say about who and what we value? Who's at the table when we're writing goals? Who's missing? Do these questions or goals matter to those who are most impacted, most marginalized, or who need the most help? Can we focus upstream on systems change? What would that look like? And explicitly, how are we considering racism in our goals and objectives? What data is available to measure racism in our community? How do our goals and objectives address racism? Remember, our goals and objectives reflect what we think is important, and when we don't address equity, that absence says a lot about our priorities. It's important we keep equity front and center when we're writing our goals. Now that we've briefly touched on what makes a goal meaningful, let's talk about objectives and what makes them SMART. Remember, if the goal is what you hope to achieve in the future, the objectives are sentences that say how you're going to get there. But what makes an objective SMART? Well, SMART objectives lay out the details for how you'll achieve your goal. A SMART objective is one that's specific, measurable, achievable, relevant, and time-bound. SMART objectives help us answer questions like who and what is involved? How much will things change? How will they change? And does that seem reasonable? Why must they change? And lastly, when will it happen? It's also helpful to consider SMART objectives early in the planning process, not to set them in stone right away, but to think about what each of the concepts within S, M, A, R, and T mean as you go. You need to have all of these components for an objective to be SMART. SMART objectives also relate to a single result. They have a really focused scope. By their nature, they can't be everything to everyone. And, of course, remember to write clearly. Be concise, avoid jargon, and make sure your audience understands your language and terminology. those same things you thought about when you previously wrote your goals. Remember our goal from the beginning of this presentation? Let's think about how we get from that goal to reality with some objectives. Let's try starting with this objective: reduce adolescent tobacco use. It's an okay objective, but it's definitely not SMART. We can see hints of SMART. We know it's relevant, for example, and reducing tobacco use is probably achievable, but the other parts are missing. For instance, how much do we want to reduce adolescent tobacco use, and by when? A 10% reduction? 50%? Next year or 10 years from now? Where could we find data on current and future use as we go forward? This objective doesn't help us make our goal a reality yet. Let's learn why. Let's start with the S of SMART, specific. It's just like it sounds. Be precise. Be clear. Your internal team and external partners should understand what you mean in your objective without digging too far for clarification. Remember, don't use jargon or insider terms that your team understands, but other partners outside your organization might not. Lastly, use verbs and action words in your objective. Thinking about clarity and words that everyone understands is especially important as you include community members on your planning team. People who aren't in your line of work, for example, or who might not speak English as a first language. It's important that everyone's on the same page as you work together. Remember, using plain language doesn't mean dumbing something down. It means explaining it in a way that everyone can understand at the same time. If you're struggling to find words to explain public health concepts like incidence, prevalence, jurisdiction, or vector, ask for help. The CDC has a great website called Everyday Words for Public Health Communication that can help you break down public health terms while remaining true to their meaning. When you're thinking of ways to be specific in your goal, focus on what and who. Who is involved? Who will you impact as a result of the action? What exactly will you do? Be clear about the action itself and the thing you're trying to move or impact. Let's take a look at what being specific means for our original objective. We want to reduce adolescent tobacco use. Remember, when we get specific, we want to consider who and what is happening. So let's try this objective instead. We want to reduce the percent of Tubman County students in grades 6 through 12 who've smoked cigarettes in the past 30 days. Who does this impact? Tubman County students in grades 6 through 12. We chose this particular subset partly because we know we have county data on current rates of smoking in this population, and partly because moving the needle on this subset of adolescents will help move the needle on all adolescents. And what do we hope to impact? Just smoking cigarettes. We're not addressing vaping or other tobacco products right now. Maybe we tackle those in other objectives. Remember, getting specific is just the first step in building a SMART objective. As we go, we'll keep revising this same objective together to make it more SMART. It's also important to remember that this isn't the only objective that will help us reach that original goal of tobacco-free adolescence. This is just one objective under that umbrella goal. Now let's talk about what it means to be measurable. When we say measurable, we want to know how we're going to show success or impact over time. To do that, we're going to use something called a measure in order to show our progress toward a target. A measure is a number or percent or some other standard unit of measurement, which we're going to use to show our progress. A target is the level we want to reach at the end of working on our objective, which shows success or impact. We are literally aiming at the target. Now, at the risk of contradicting ourselves about jargon, words like measure and target can feel sort of hard to visualize and are a little jargony. So let's break down measures and targets and what they might look like in real life. We just learned that a measure is some sort of standard unit that can show our progress. For example, if our goal had to do with tobacco prevention, and our objective was working toward adolescence specifically, a suitable measure might be the percentage of students smoking over the past 30 days. In looking at the data available, we might learn that's currently 18% of students. So here's our reference point. Here's where we're starting out, and we're going to monitor our progress out from that 18%. Now let's think about a target that can show the direction and the amount that we hope that measure moves. What might success look like in the future? Maybe we decide we'll have achieved this objective when we've reduced by 5 percentage points the number of students who've smoked in the past 30 days. That is, we hope to move from a rate of 18% to 13%. We have an amount and a direction. It's also important to tie your measure and target to a specific data source that you know you can rely on for current and future data. A regular survey or publication, for instance, or a state or local agency. It's up to your organization and your partners to decide what an appropriate target is and how much change you want to see. In this example, because the current rate of students smoking in the past 30 days is 18%, a 5-point reduction is probably a pretty admirable target. If your current rate of student smoking was lower or higher, for example, you might consider a different target for reducing student smoking, a bigger or smaller target. Here are some questions to consider when you're wondering what it means to be measurable, which we just discussed with real-life measures and targets. How much and in what direction will change occur? What data will you use to prove that the target is met? Where will this data come from? What if you can't find data to measure this objective? Is there a stand-in or a proxy measure you could use instead? If not, do you need to choose another measure? Here's our original objective again, with the last smart modification we made to it. Reduce the percent of Tubman County students in grades 6 through 12 who have smoked cigarettes in the past 30 days. Remember, when we measure, we want to show the impact over time. How much of this will need to happen to show progress or success? So let's try decrease by 5 percentage points the number of Tubman County students in grades 6 through 12 who've smoked cigarettes in the past 30 days. How much of this action do we need for progress or success? A 5 percentage point decrease. And you can see we've got our baseline and data source ready to go right there at the end of our measure. Now let's pause for a moment because we're going to skip ahead in our SMART order, and it's important to know why. When you're planning out your objectives, you might instinctively already reorder the SMART components and start with S, M, and T. This is because the specific, measurable, and time-bound parts are often evident when you write out a SMART objective. They're naturally easier to identify and address, and you can write all of your objectives following a similar format that easily addresses these three components. The achievable and relevant pieces of your objective require reflection and discussion. They're more abstract and might not be spelled out as directly in your objective. You might have to stop and think. What is your organization capable of achieving? Is this objective relevant to your goal, your organization, or your target population? So sometimes it's easier to start with specific, measurable, and time-bound, and then stop to think about what achievable and relevant mean for your organization and your target population. Let's dive back in, now that we understand why we're skipping ahead for a moment to time-bound. Making a time-bound objective means attaching a reasonable date to your objective. But what's reasonable? Well, you want to try to find the sweet spot between a time that's not too soon and not too far away. A date that's too soon might not give you enough time for a successful outcome. Has enough time passed to tell whether your action steps made a difference? A date that's too far away might make your team procrastinate or think it has more time than it does. Or it might be so far off from right now that you can't connect the dots anymore. You can't say for certainty that your actions are what helped move the needle on your objective. It might also be the case that you just have to wait until data is available. In that situation, your time is set for you. With that, you likely know what sorts of questions to ask. Is this time frame realistic? Should we set the time frame closer to today, or maybe further away? When will data be available to help us track this objective? And do we need to adjust our time frame accordingly? Here's our original objective again, with our last smart modification made to it. Decrease by 5 percentage points the number of Tubman County students in grades 6 through 12 who've smoked cigarettes in the past 30 days. Let's provide a reasonable date by which this could happen, making this a time-bound objective. By December 31st, 2022, decrease by 5 percentage points the number of Tubman County students in grades 6 through 12 who've smoked cigarettes in the past 30 days. What makes this time-bound? We're hoping to reach this target by December 31st, 2022. You'll note here that we gave a specific date and didn't just say by the end of this year or in the next 5 years. This is helpful for someone who might not remember when the plan was written and doesn't know when a week or month or year out is from the publication date. So now let's circle back to achievable. Remember, an objective needs to be within reach for your team to make it worth your time and effort. Be sure to consider what available resources you have, what knowledge your team has or lacks, and the time available to complete the job. Some things you can ponder as you decide what's achievable include: how will the group accomplish this objective? Who's involved? Who's missing? Who's ultimately carrying the ball across the goal line? Do we have enough time? Do we have a supportive environment? Given those things, do we need to scale back our target or time frame to be achievable? Or maybe we're not aiming high enough. Is the time ripe for bigger action? What resources do we have on hand? What are we missing? What limitations, constraints, or risks stand in our way? Here's our original objective again, with our last smart modification made to it. We can see when something will happen, how much and in what direction, and who our focus population is. Now it's time to consider what's achievable for our team. What's reasonably within reach? We know many factors go into reducing teen smoking rates, and our plan's actions can only do so much. Maybe we don't have enough community consensus for widespread action yet, and without that collaboration, we can't reduce teen smoking as much as we first thought. So let's amend it. Instead of 5 percentage points, maybe 3 seems more reasonable, given available time and resources. Let's acknowledge together that writing objectives for long-term population level change can be really challenging. We have to use caution when we're writing objectives for just one plan, when we're trying to change something so huge. For complex long-term issues like obesity rates or smoking rates, it may take decades to see change, and many factors contribute to the issue beyond just our organization's actions. Who's on the hook if you set a target you can't meet? Do you need to meet it to qualify for funding or for the continuation of your program? If it's too big an issue, can you just measure the direction of movement without a concrete target? Some teams choose to measure movement from a baseline without setting a specific target number, and that's okay. Choosing to purposely omit the target of your objective when appropriate is different than just skipping it. If you can't pin down a concrete target, think about an intermediate objective that's more realistic, and balance it with a long-term objective to tackle your goal on multiple fronts. Let's think about what intermediate and long-term objectives might look like in practice. These two objectives follow two different timelines, but both have to do with the same common goal. Remember, our objectives sit under the goal like an umbrella, but it doesn't mean they need to operate on the exact same timeline. In the intermediate, on the left, we'll seek to increase passing tobacco compliance checks by 2022. In the long term, on the right, we'll seek to move the needle on the rate of teen smoking itself by 2025. Both objectives will help us meet our goal with different timelines and scopes to make them achievable. In the intermediate objective, we note how much we hope to change the past checks and in what direction, because we believe it's an achievable target. In the long-term objective, we purposely omit a concrete target number and just use a direction. This feels like the achievable way to state this objective. Finally, let's talk about what makes an objective relevant. Objectives should align with a corresponding goal. Always consider whether and how an objective helps you meet that goal. Your objective should relate to the larger program or plan, or to your organization's mission, vision, and values. Is your objective important to the team and to other partners? Your organization's leadership is more likely to approve objectives related to your mission, vision, and values. And if partners and decision makers support your objective, you're more likely to see greater buy-in later from other partners. Finally, consider whether it will help contribute to meaningful change in your focus population. Some things to consider include, will this objective help us achieve its corresponding goal? If not, does it belong in a different goal? Should we set it aside? Is it worthwhile to measure this objective? Will staff understand why we're doing it in the first place? Does it have meaning to them, or to our partners, or our target population? Here's our objective again with our last SMART modification. To clarify relevance, let's think back to our goal. All county adolescents are tobacco-free. Let's reflect together. Does our objective, as written, help us meet that goal? Is it meaningful? Upon reflection, we can see that reducing smoking rates in this target population does move us closer to all adolescents being free of all types of tobacco. So, yes, it's a relevant objective. In the end, there's no one single way to write a SMART objective, though you might like to choose a specific format and stick with it, just for the sake of internal consistency. Once you've made sure your objective is SMART, you're good to go. But here are some frameworks that you could fill in, sort of like Mad Libs, while always circling back to consider whether something's achievable and relevant as you go. Remember, you can use SMART objectives for more than just community health goals, although that's mostly what we've used as examples today. You can write SMART goals for all sorts of plans, including QI and strategic plans, and for internal performance measures. Performance goals might look like the ones on this page, having to do with customer satisfaction, user knowledge, or QI competency. As we wrap up, we've covered a lot of ground today. We're glad you've joined us. This presentation lives alongside the entry for SMART objectives in MDH's Public Health and QI Toolbox, which is an online group of tools and resources to help you operationalize your big ideas and break them down into concrete actions. The toolbox contains step-by-step instructions for about 40 different tools to help you with quality improvement projects, community engagement, customer focus, and more. You can find the toolbox by visiting www.health.mn.gov and typing QI Toolbox into the search bar. Once you get to the QI Toolbox and you choose the page on SMART objectives, you can scroll down to find a list of state and national resources that we'll keep updated on an ongoing basis. Thanks for joining us today. We wish you success as you move forward, using meaningful goals and smart objectives to ultimately help your communities thrive.